Hello, everyone, and thank you for being here. My name is Alyssa Arnheim, and I'm the host of the Healthy Gut, Happy Child Summit. Nourish your child, release their vitality, and watch them thrive. Our children are experiencing skyrocketing rates of autoimmune disease, allergies, autism, behavioral issues, and more, and these can all be tied to the gut. It is unacceptable that their generation is expected to live shorter lives than their parents. So I've gathered the foremost experts on supporting children's gut health to give you specific strategies, the most progressive, cutting-edge science, and experience-based wisdom in everything from food to medicine to lifestyle, so you know exactly what to do to help your child thrive. And today I am so thrilled to have Dr. Emma Sutherland here from Australia. And let me tell you a little bit about her. She is the highly experienced and pioneering naturopath in Australia's functional medicine movement who founded Studio U, a clinic dedicated to women's health and pediatrics. She believes that every woman has the right to live a life filled with mojo, to feel strong, well, and healthy. One of the main pillars of her practice is optimal gut health for calm digestion and high nutrient absorption. And Emma is a mother with firsthand experience resolving her own and her daughter's gut issues. It is such a pleasure to be speaking with you today, Dr. Sutherland. Welcome. And
thank you. Thank you. And just to clarify, here in Australia, I'm not a doctor. I'm a naturopath. I know we have different kind of titles, but I don't want anyone from out of Australia thinking that I'm a medical doctor when I'm a naturopath. So I'm a naturopath.
Thank you for clarifying. Thank you very much. Well, you have an incredible wealth of information, and I want to talk about everything. But maybe we could start with your personal journey and how you arrived at this place in your profession and your personal life with women and infants, and tell us all about it.
Well, I've been practicing as a naturopath for nearly 15 years now, and I've long been fascinated with the gut, but as a naturopath, it's one of our core philosophies and has been for hundreds and hundreds of years. So always had that fascination with gut health. And then working with mums and their kids, I started noticing clinically how relevant gut health was to what I was seeing in clinical practice. And then becoming a mum myself 5 years ago now, that then upped the ante even more on my passion and hence my learning about gut health. My personal experience was that my gut was never my forte, but my gut health was really driven by my adrenal health. The adrenal depletion came first, followed by the gut health. But it was more through my daughter Sophia that I learned most of what I know about the gut. When I was pregnant, Sophia was a breech baby, and I couldn't give birth to her vaginally. We tried, but she just didn't come. So I had to have a C-section. And as a naturopath, that was really hard because I knew the importance of that initial inoculation of microflora through the vaginal canal. And unfortunately, despite all the trying, breastfeeding was also very challenging for us, and I couldn't breastfeed for very long. So with those two things, I knew that we were on the back foot with her gut health straight away. From 3 days old, she was taking probiotics. But for her, her gut health, just from day one, was not good. She had horrendous silent reflux, and we had such an awful time trying to work out and deal with her silent reflux, and kind of no matter what I did from a natural aspect, nothing was stopping that eternal screaming that happens with reflux babies, which is horrible. And she went on PPIs, right? And then I feel from that point, her gut health really started going downhill. She got a strep throat infection at 14 months. And she was very unwell with that. And she did end up taking antibiotics. At that point, once again, that huge dilemma as a practitioner that knows so much in this space, but when you have such a sick child, it's your last resort and you've tried everything else. But from that moment on, she then had chronic constipation. And when I did some very comprehensive functional tests on her gut health, 3 or 4 months after that, I found that strep infection had migrated from her throat down to her gut, and her gut was about 93%, her gut microbiome about 93% strep. So we then had a long protocol and quite an arduous journey to fix her gut. And that did take about 10 to 12 months. And her bowels are fantastic now. She's now 5 though, right? So it has taken a long time and a lot of continual effort to make sure that her gut health remains as it is. And actually I've just retested both of our gut health with the functional tests that I do, and I'm awaiting results now to just check in. Every year I just check in now and be really proactive and keep on top of things. So it's been a lot of clinical experience, and then combine that with my own experience and then my daughter's experience. Like, nothing compels you more than when you're a parent and you're watching your child suffer.
Right.
Really motivates you, right?
Oh yeah, I totally understand that. And I love that. I love hearing about how it's changeable. It's like you can get a really rough start and you can fix it. So
yeah. Look, I think that the earlier you get in, the better. There's some researchers that sort of say, by the age of 3, our gut microbiome is sort of set, like, and then we default back to that at later points in life. So we want, and I talk to clients about this, we want that microbiome to be as healthy and as diverse as possible by the age of 3. So really working hard on their gut health in that first 3 years is paramount. And I was reading some research the other day that showed that children that have a more outward, confident, happy disposition actually have a more diverse gut flora than children that tend to be quite reserved and shy. So very interesting about, the gut is, there's so many ways it can affect us, doesn't it? It's incredible.
It is really incredible. So can you tell us some of the strategies you use with young babies to get them to that state of great diversity by the time they're about 2?
Look, 3, yeah. First of all, if you have the time and the opportunity, it's about starting with the mum. I always explain to my preconception clients that, your gut health becomes the blueprint for your babies. And it's so important to get the maternal gut health as optimal as possible. So if you have that opportunity to optimize the maternal gut flora, then it is about testing her gut, seeing what bacterial species are undergrowing, what are overgrowing, and trying to create some sense of balance. We are all going to have undergrowths and overgrowths going on. That's just the organic nature of our gut. But trying to get a reasonable balance of really good, healthy, anti-inflammatory, great bacteria, and less of the pathogenic bacteria is what we're aiming for. And we know from the research so much about the gut these days that, if we have a high maternal environment of certain bacterial strains, it actually reduces the risk of asthma, eczema, hay fever for their child. Particularly in a country like Australia, where we have some of the highest rates of asthma in the world, it's really important that we work on the maternal gut flora. So that's my step number 1. First of all, start with mum. And a lot of people don't make that connection. They think that mum and, baby are 2 separate entities, when they're energetically and physically, they're really one entity for so long. So much longer than their, 10 months that they're actually in utero.
Wow. So do you have any specific strategies once the child is born? There are a lot of moms out there who are thinking, okay, I've got this baby and now I'm learning about gut health. Okay, what do I do? Yeah, good point. First of all, if you're breastfeeding, congratulations. That's an amazing start for a baby.
They're around, a ridiculous amount of beneficial bacteria in just 1 ml of breast milk. So if you are one of those lucky mums that can breastfeed, amazing and awesome. If you can't breastfeed for whatever reason, which happens quite commonly these days, I think the more stressed mums are, the harder it is to breastfeed too. It is about introducing some bacterial strains into your child, into your newborn, that are going to help that initial inoculation. Mm-hmm. So, the Infantis strain is a fantastic strain to get started with. I don't recommend going out and just buying things off a shelf and just giving them to your baby. I please just want to caution that it's always a good idea to speak to a health practitioner before, giving anything to a baby. But it's really important that if you're breastfeeding, fantastic. If you can't breastfeed for whatever reason, a lot of skin-to-skin contact, obviously that's going to help, and making sure that you are introducing those good bacteria in another way.
Okay, awesome. And when it's time to start introducing foods to your baby, do you have a particular method that you think works really well?
Yeah, I mean, we've got to think about the fact that, babies, they're used to, whether it's breast milk formula, but they're used to milk, right? And that lining on the gut that's 1 cell thick, is so sensitive to being damaged. So we want to start with foods that are very gentle, and that actually have a lot of good fats in them. So things like bone broth, I'm always asking my patients to make bone broth for their babes, and make sure that they're giving their babies bone broth at the first introduction of solids. Obviously continue breastfeeding if you are breastfeeding, that's great as well, but making sure that you're introducing foods that are less irritating. Now, there's a lot of debate, especially in Australia, about how to introduce solids. And because we have such a allergy-prone country, there has been some research show that there's a window of opportunity between the ages of 4 to 6 months to introduce small amounts of a potentially allergenic food, and that can reduce the actual incidence of allergies later on. So, we do look at small, tiny amounts of those foods, like it could be, a small amount of egg, that kind of thing. But essentially, I always start with fats. I do not start with rice cereal or rice rusks. No. No. We're starting with things like avocados, soft boiled egg yolks, lots of rich fats, because that is what babies need for rapid brain development.
Okay. Oh, this is great. This is such great information. So I've got a couple of things that I've written down that I was really interested as I was learning about your work. And so in addition to supporting kids' digestion, which we might come back to, get to some other ages, you devote a lot of space to caring for the mama. How does this play into gut health, not just for the mama, but then for the child?
Yeah, I think that mums become incredibly depleted, because what happens is that they then generally, once they have a child, they go to the bottom of the priority list, and our sleep gets compromised, our food becomes patchy and erratic, our hormones can get wobbly and all over the place. We can have undiagnosed thyroid issues, undiagnosed adrenal issues. It's really so brutally depleting for a woman to become a mum. Every cell of that baby has to come from you, and every need of that baby for at least the first 12 months needs to be met by you. And that's a grueling job, and one that I think that in society that we really don't applaud our mums enough for. And I really see the impact of that clinically, because I have a lot of women that come and see me post-baby, and they're just completely depleted. And we really have to start at ground zero and really talk about the fact that, your digestive health is not just about all the good bacteria and bad bacteria. It's about how much are you absorbing from the food that you eat. So when we have this chronic stress response where the adrenals are turned on and the adrenaline, the cortisol levels are up, we are down regulating our digestive function. We're not producing as much hydrochloric acid. We're not producing our digestive enzymes as well. So that then means that you're not absorbing and extracting all the nutrients that are found in the food that you're eating. So I often say to mamas, you might be making the effort to eat really good food, making a nice salad for lunch, but how much of that are you actually absorbing? Or are you having really, are you really not pulling much of that nutrition in and getting that vitality into your cells? Yeah. And most women look at me and they're just like, I don't feel like it's going into my cells. So we really work out, and I often call it, let's just do a bit of insurance on your gut so that when you're eating, we know that you're absorbing more from your food and you're able to fuel yourself a lot more effectively to give you more resilience to the demands of being a mama.
Oh, yeah. Yeah, I hear you there. That sounds great. And so you actually offer meditation classes, not just for adults, but also for kids.
Yes, and I am so excited to be able to do this in this amazing clinic. We have a beautiful teacher, Alison, and we sat down and we thought about what we'd like to offer to our patient demographic, and the art of meditation is just something that I wish every child in the world could learn, because I feel like their gut health would be so much better. I feel the world would be a better place. And so we do run Zen Warriors, which is our course for kids. At the moment, we've got a 5 to 8 year old age group running. My daughter Sophia is doing it, and hilarious. The other day I walked into the lounge room and I just caught her. She put out a mat, like a sarong. She was sitting on it and she was meditating. And I just thought, you know what? Kids really absorb the strategies of meditation, and they're going really well, the meditation classes, and we're getting great feedback.
Oh, that is so nice to hear. That is so nice to hear. Can you tell us a little bit more about how meditation will help a child's gut system?
Yeah, absolutely. So I think when we are meditating and we have sort of jumped into that parasympathetic side of the nervous system, that part of the nervous system that we call that rest and digest, where we are calm, when we're breathing deep into the diaphragm, when we're producing more digestive enzymes and our body and our digestive system is ready to actually break down foods and extract the nutrients, then when a child eats, when they've been in that state, they're going to absorb way more of their food as well. So I think that when you have kids that are anxious, or, just the demands of life, they're at school, it's busy, there's a lot going on, there's probably too much screen time in most children's life, I think, these days, and the ability to go into that state of imaginative play is reduced, because that state of imaginative play is quite a meditative one, right? They're just in their own little world, being quite creative, and that's nice and calming. But a lot of kids don't get enough imaginative play. There's a lot of scheduled activities for them to go to. There's a lot of screen time. So I feel that giving them a skill of meditation allows them to tap into that really natural side of them. Kids love to just do that imaginative play and be in that sort of parasympathetic side of the nervous system. So if we can encourage that and give them opportunity to experience more of that, then we know that their gut function is going to be better. We know that intestinal permeability or leaky gut is going to be less likely to happen for them. So we know that every function of their gut is going to be optimized with that kind of activity.
I love this. Wow, this is a great strategy. And it sounds super effective in more ways than digestion, probably.
Oh, absolutely. We have feedback from the parents that have said that, their child's ability to have what I call emotional bandwidth a larger emotional bandwidth is better now, rather than the emotional bandwidth being really narrow and the child's being very reactive. The emotional bandwidth just comes out a bit and the child's less reactive. That's the feedback that we're getting, which is just fantastic to hear, because that means I know that these kids are less stressed.
Yeah. And I can imagine that feeds right back into being able to digest your food. Feeds right back into their capacity to be in that rest and digest state if they're not so reactive.
Absolutely. Yeah. It's such a win-win. That cycle is fabulous.
Oh, I love it. So do you have any specific like go-to snack recommendations or like favorite lunches that are really supportive of gut health in kids that kids will actually eat? I know a lot of people want to feed their kids healthy foods, but it's hard to imagine switching up their diet, when they're expecting certain things.
Yeah, absolutely. And this could be a whole summit on its own about how to change kids' food, right? Because kids are creatures of habit. So when you create change for them from a food perspective, we can't expect them to, just because we have this intellectual knowledge about something, we can't expect them to just completely change quickly. It has to be something that's done slowly and over time. So, for example, one thing that I did, because she's just, my daughter Sophia's just started school, so it's, me packing lunches every day, is that I started making her homemade sushi, but I use black rice. So black rice has more prebiotic starch in there than white rice. So it's those little kind of swap outs that you can start with that are kind of a little bit easier. So I'll make her a smoothie in the morning and I'll use kefir in the smoothie to, just give her that little kind of hit of probiotics first thing. And I think it's more about making small, subtle changes with your child, with their food, rather than making big ones, because they will resist big change, but they're quite open to very small, subtle changes.
Okay. Does Sophia have a favorite lunch?
She's, you know what, it's actually, right, it's quite interesting, right, because she's actually an awesome little eater, and generally always has been. There's been pushbacks at time, but I'm quite strict in my food kind of philosophies with her. And one thing that I always said as soon as she was born, I said, I will never do any short order cooking. I will never cook her a second meal if she doesn't like the first one. Right. And it's something that I stuck to from the very beginning. And I remember when she was around 2, that typical age where the palate kind of narrows and they start pushing back, and they start using food as actually, I can say no now, and they use food for that kind of expression. There were nights when she went to bed without eating. And I was like, you know what? I'm not going to open that doorway of cooking 2 meals and catering to her in that way. And although it was difficult to say no, I really feel that as a result, she is a better eater for that. Yeah, I really do. So it's tricky, and I empathize with moms all over the world about how tricky it can be to get your children to eat things. But I think work on small, consistent changes. We know from the research that a child needs at least 20 exposures to a new food before they'll even consider putting it in their mouth. Little kids are hardwired to resist change. So we need to be persistent enough to keep going. And I think that most parents possibly give up a little bit early, because it's really disheartening. The 4th time, 5th time, 6th time you've put, a tiny little tree of broccoli on their plate and they've ignored it. It's easy to say, oh, well, they just don't like it, and not do it anymore. But just remember that 20 exposure rule, and I think you might find that you'll have more success.
I love that. Persistence and perseverance.
Yeah, and the other thing I have to sort of say on the food front is really work hard to keep your game face on. Don't show any emotion around displeasure or being frustrated or annoyed with them, because that starts to become an emotional battlefield, and that is not ever going to be a win-win situation. So if they refuse things, just leave it on their plate, and then just calmly take it away at the end of the meal and don't cook them or give them something else. That was their choice.
Perfect. It's so good to have clear strategies in this regard. It's great. So I'm curious, when women come in and when people bring in their babies with gut issues, what do you see the most of, and how do you know what it is? Like, what are the most common symptoms and illnesses you see? And then, what happens when you treat it? What can people expect?
It's interesting because we do see a cluster of symptoms that are more common. We will see a lot of respiratory incidences, like whether it's frequent colds, asthma, sinus, adenoids, ear issues, but we'll see that sort of upper respiratory and respiratory weaknesses, a lot of suspected food intolerances. Food allergies here are common, but most parents are very aware if their child has a food allergy because the reaction is so strong. But food intolerances are far, far more subtle, and a parent may just feel that their child gets very bloated after having milk, or doesn't sleep well after they have this food, or what have you. So we see a lot of suspected food intolerances, a lot of sleep issues. So sleep, it's interesting because I'm also an infant sleep consultant, although I don't practice that anymore. I've got all that knowledge, but it's amazing how much children's sleep improve when their gut improves. And I cannot tell you how many parents would agree with me that I have treated, that they come in because their child just is having sleeping issues. And I say to them, you know what, I just want to run a couple of tests and see how their gut is going and see if we can optimize things there. And then, 3-4 months later, they'll say to me, when I ask them, how is Josie's sleep? And they'll go, oh, she's sleeping fine. And I say, I remember that's why she came here in the first place. So we see a lot of sleep. And of course, the obvious gut things like my Sophia had, which is the constipation. And we also got a lot of eczema as well. So skin complaints. Yeah. So that's the cluster of things that we see on a frequent basis. I will 99.9% of the time say to the parent, I really highly recommend that we do some testing to work out what's driving your child's symptoms, rather than just using a Band-Aid treatment approach. That's not the way we work. And we want to look at, this child very holistically, how they're sleeping, what they're eating, if they're at daycare, what's it like. We want to know every single tiny little bit of information about this child so that we can then make a full assessment and decide which path is going to be the best path for treatment. But we do use a lot of functional medical tests, which I really find a lot of value in because they really confirm and give us a template for treatment. So we know, let's say for the gut testing, I know what bacterial strains are undergrowing and what are overgrowing, and that then allows me to treat appropriately rather than just treating everybody the same, which is something we would never ever do.
Right. And so with maybe the functional medicine tests that are revealing what kind of bacteria are growing or not growing, then are you using food? Are you using medicines? How do you restore the bacteria you want to restore and kind of shift the less desirable bacteria to lower numbers? How can you do that?
Interesting. Yeah, it's very different treating kids to treating adults, because obviously adults can, they can take awful tasting herbs, they can take, bigger tablets, that kind of thing. So with kids, it is more difficult. But depending on the bacterial strains, I do use antimicrobials. So whether that's plant-based or mainly it's plant-based, herbs we do use a lot. We use a lot of getting the gut terrain right. And what I mean by that is we want to make sure there's enough prebiotics going in. We want to make sure the stress levels are down so that the gut can flourish. We want to make sure that the food has, a lot of color in it, because the more color in their food, the more prebiotics and antioxidants. They're getting, I also am a homeopath, so I'll treat homeopathically sometimes as well. We do use a lot of nutritionals, so we will use things like vitamin D, zinc to help reduce inflammation and increase the healing on the gut lining. I use a lot of glutamine and amino acid that, once again, helps the gut lining. So we treat. We have a very large toolkit to treat from with our kids, and we have definitely, we do give all of our parents a document called How to Give Your Child Their Supplement, and it's like 20 different ways that they can actually get that supplement into their child. Yeah, because I mean, I'm a mum. Most of my clinicians are mums. We've been there. We know, that it's not always easy. And from that aspect, so we want to help our parents as much as possible. But one thing I'm going to say is that most of the time children are actually really good at taking things. Often it's the parents' kind of nervous expectation that their child will just refuse that can actually trigger the child. So I always say to the parent, I want you to try their things first out, when Josie's gone to sleep, I want you to try that bit of zinc or that bit of vitamin D or that bit, so you can actually see that it's not that bad. And then when you go to give it to her, you can actually have your full game face on of, yeah, this is great. Mommy's tried it. It's all fantastic. And I'm a big believer in actually explaining to the child themselves. I mean, if they're a baby, maybe you can't, but I start young. The more that we can educate our little kids on the fact that, we're working on making their gut happy is really important. Like Sophia says to me intuitively now, she'll say to me, Mama, I need some happy bugs with some manuka honey. And she'll get her teaspoon and put the manuka honey on, and I'll put the probiotics on, and she'll just eat it. So if you get in, they know. Kids are so intuitive. They really are.
I love that. Wow. I love how you support the parents. I love that. The way we behave as parents has such a huge impact on our children's receptivity and their stress levels and everything about that. It's really fantastic.
Yeah. And that's the spiritual and emotional link between a child and their parents. It's not just this physical attachment. It's so much. There's so much energy and spirituality that just because we don't see it doesn't mean that it's not there, and that has a profound impact on their health as well. Yeah,
it sure does. Well, I also wanted to ask you about, I was going to ask if you had one single message that you wanted to get out there to the world of parents about caring for their children's gut, what would that be?
That's a tough question. I think it's definitely never too late. So if you're listening to this information and your child is 8, it's never too late to start supporting your child's gut health. And just think about the fact that if you make small incremental changes over time, that will have a big impact. So don't feel that you have to take everything on board that you're listening to through all the amazing speakers on the summit. Just pick 2 or 3 little things that you can do on a regular basis with your child, and just keep that consistently going, because trust me, it will make a big difference over time.
I love that. All right. And while you're, because you're mentioning the older children, I was wondering what your strategies are for more, for like maybe teenagers, kids who are still like under the direction of their parents, but are feeling really independent in a way also. How do you work with that?
Yeah, often I will actually ask the parents to leave, out you go. I just want to talk to your child for a little while, because once they get to that point, they're little adults, and I respect them enough that we need to have a one-on-one conversation, and I need them to understand what they're doing here and what they understand by the process, because often it is a well-meaning parent will book a child in, or an older child, and I had a teenage girl sitting here last week opposite me, and I said to her, "Why are you here?" And she goes, "I've got no idea." And I said to her, "Okay, all right, let's just start with that." And it's really important to clarify and get that person on board, because they are in what I call a hostage situation, right? They're not choosing to be here. They are not open to the process. They're just being told. So if you empower them and get them involved, then you're going to have a lot more success. So often that means telling the parent to hop it out of the room, and then at the end of your conversation with the teenager saying, is it okay if I get mum back in, just to give her an overview of what we've spoken about, and if they say yes, then get the mum back in and have that open conversation then. But and then I always maybe email mum afterwards and say, how you going, any other questions, but it is about having total respect for that individual and getting them on board.
Yeah, that's wonderful. How often when you are treating a child, do you end up deciding, oh, well, maybe we need to treat some more of your family? How often does this become like kind of a family effort or a big family shift, a sea change?
Look, a lot. And it's also because when I'm doing, let's say, for example, I have got a child with food intolerances, and she's got 2 siblings and mum and dad, I'm always saying it's got to seem as natural and as smooth as possible. So if you're sitting down for breakfast and Josie can't have cow's milk and your other 2 children are still having cow's milk, then we've got to make some changes across the board while we do this protocol. And it's going to be easier for the parents to do one thing for everybody as well. I think that often it becomes a case of mum or dad sees improvement in the one child and then realizes that maybe their other children also could be optimized. It's all about optimizing health. You don't have to be really sick to have an unhealthy gut. I have tested a lot of people, and a lot of the times they're seemingly okay and they don't have any obvious gut issues, but 50% of gut dysfunction is outside the gut. So it could happen to your nervous system, it could happen to your skin, it could happen to your behavior, your mood. So often it becomes a family affair. Yeah, very common.
Wow. Well, thank you for everything you are sharing today. This is amazing. Is there anything that you want to add that I haven't asked you about?
I think just for everyone to keep in mind that gut work takes time. With Sophia, it took 10 to 12 months before we really saw great outcomes. Mm-hmm. So I just remember it takes time, that you can now do too little, and just those small changes over time will have a big impact. So just start with small things, keep it kind of feel, but keep it going. Okay, great advice and doable advice. Yeah, it's got to be doable. Our families are busy. Yeah, they are. So I have one last question that I ask every one of our speakers, and that is, what is something you're grateful for? I am so grateful to do this kind of work. I'm just so grateful that I get to be in this beautiful clinic that I founded. It's like a dream come true. Like, honestly, it's the best thing I can't imagine doing anything else. It's such a passion of mine. Oh, Emma, I am so happy you're doing your work also. Me too. Well, thank you so much for sharing everything. It has been such an honor to speak with you and get to learn from you and get to share this with all of our audience. So thank you again. And thank you so much. Take good care.